Cancer is a big problem in our country, but up to a couple of years ago, we weren't paying a lot of attention to people who had cancer. So basically what happens is that as people were diagnosed, they were diagnosed at stage 4, and then they already have a lot of complications, so we really couldn't do much for them. What we want to do is to take a step back and to be able to screen people early. And if we do this screening early, then we can pick up changes in the body and therefore address them before they become a problem. If we are going to screen people to know whether or not they have breast cancer, one of the more reliable types of tests that we have to do is the mammography. But up to maybe a year ago, we only had one mammography machine in the public system. That machine was at the Georgetown Hospital. And think about all the women who were eligible to do a mammography test having to travel all the way to Georgetown Hospital to get that test done. It was not feasible. They wouldn't be able to do everything for everybody. And therefore, one of the decisions that we made in the government is how can we decentralize this service. So last year, we bought 4 new mammography machines. And we placed one in Linden. We have one here in New Amsterdam. We put one at Suddy. And we put one in Lethem. It took us a while to prepare the room, but once that was done, we were able to install the equipment. And when you go and you see the equipment, basically it's one of the top brands in the world. That's Siemens. So whatever we are doing, we are trying to make sure that we get good quality imaging. And so we now have mammography being available at this hospital. And we expect for the entire catchment of Region 5 and Region 6 that we'll be able to do these screenings for women. This year, we'll try to buy another couple of machines, and then we'll put them at other hospitals. But we want to make sure that in the different hospitals across our country, that these services are going to be available. So the government is investing a lot of resources to prevent cancer. So the outcome is that people shouldn't be, throwing back and you get cancer and then you give up and you die. If we proactively go and get the screenings, we can detect these things early, and by early detection, we can fix the problem before it actually becomes a problem.